and so she is the perfect person to hand this session over to. So Dr. Nicole Fisher-Roberts, welcome, and it's over to you.
Thank you. Thank you so much for having me. I'm very excited for the conversation today. There are a lot of questions that we all have about recovery of our economies all over the world, individually and collectively. And so I think we have the perfect guest to have that conversation. So I would like to introduce our guest, and we have one caveat for today. So first we have Edmund Bartlett, the Minister of Tourism for Jamaica, who's recognized for his wide-ranging expertise and accomplishments in the political arena. Honorable Bartlett has given over 35 years of service to Jamaica, working both in the House and in the Senate. And currently, he is starting Parliament. So he may be popping in and out because, as we all know, starting Parliament is exceptionally important and can't happen without him. He's viewed by some as the world's leading tourism minister, and he has represented Jamaica regionally and internationally, and currently chairs the board of affiliate members of the United Nations World Tourism Organization. So we'll welcome him as soon as he gets back over to us. And also we have Timothy Evans, who's a founding member of GAVI, which is the vaccine alliance overseeing the COVID-19 vaccine distribution in partnership with the WHO through the COVAX facility. I'm sure we've all been hearing about that lately. He's also the previous Senior Director of Health, Nutrition, and Population at the World Bank Group, and has previously served as the Assistant Director General of the WHO, where he oversaw the production of the annual World Health Report that I'm sure all of us read on a regular basis and cited in much of our work. So I'd like to welcome Tim to the stage. Is Tim here? Did I lose him? There you are.
Great, they just let me in.
Excellent, excellent. Well, welcome. I just did an introduction. I don't know if you got to hear it. And I read through your bio, noting your work currently as a founding member of GAVI, but also from the World Bank Group and then the WHO. So very impressive background. And I think it makes us all feel better that we're in good hands.
Great. Thanks,
and so as I let the audience know, we are going to have Honorable Bartlett sort of pop in and out. He's starting Parliament. And so you and I are going to get the conversation going, which is excellent because I wanted to start with you anyway, because I want to start this conversation big and broad, because this is a conversation that would have sounded different even 4 weeks ago, talking about sort of the future and where we're going. So I'd like to start with talking about the economy and as it pertains to the pandemic. So from your perspective, what major shifts do you think we have to look forward to in 2021 and beyond, but specifically in the coming year? And then how do you expect these shifts to particularly impact emerging markets? Are you frozen?
Yeah, I just wanted to make sure I got the question. You're saying I was frozen for a couple of sections of your comment, but I understand, Nicole, you said that within the last 4 weeks that you felt things had shifted significantly, or we wouldn't have had a perspective that we do today, even 4 weeks ago. And I was wondering what you were referring to. I missed that.
No, I was just saying the conversation may have sounded differently 4 weeks ago when talking about the economic impacts going forward in different countries, particularly in emerging markets. And so sitting where you do today, what do you see as the major shifts that we can be expecting in 2021 and beyond?
Yeah, well, I think we've got we still have a distance to go. I think we have the meteoric arrival of vaccines in terms of production, which has been really the most promising exit strategy for the pandemic. And so the overwhelming global priority is to get as many of those vaccines into people's arms as quickly as possible. And as we do, that will help stem the pandemic and help build confidence in opening up. So I think that's going to be particularly important. But that road to recovery will probably be quite bifurcated in the sense that some areas of the economy will recover or have actually benefited from the pandemic. They've done quite well, whereas other areas like travel and tourism have had a particularly tough time. And I think in the context of Jamaica and other Caribbean islands, that understanding what the primary constraints are to reestablishing that industry is going to be particularly important in managing perhaps a faster recovery than might be expected otherwise.
Mm-hmm. Yeah, and so what from your perspective, what needs to happen to drive economic recovery?
Well, I think the first thing is, and you may not be surprised by this, but as a public health person, you really have to be investing in people's health and investing in good health security or conditions that minimize transmission is actually intimately linked to bringing an industry back into focus and into viability. So first and foremost is to establish really solidary sanitary conditions which are going to ensure that people are not putting themselves at excess risk, and that there are accommodations that manage infection transmission in such a way that you're at no greater risk than you would be at home. So I think that is absolutely the first thing. The second thing is vaccinate. Everybody needs to be vaccinated everywhere. It's the biggest global vaccination program ever. The US may be doing that a little faster than expected, but that's a small part of the world's population, and we really need to be, as there's the WHO, UNICEF, GAVI, through the COVAX are promoting vaccination and have started delivering doses to low middle income countries. That will help reduce collective risk enormously, and so we really need to support those efforts. And I think the third thing is really to focus on behavior and understanding individuals' behavior. And this is one where there'll probably be adjustments that are needed related to vaccine hesitancy. And understanding people's reluctance, perhaps, and trying to encourage or minimize that as a problem for getting good vaccination coverage. But also, Nicholas Christakis just has written a nice book called Apollo Zero, in which he talks about the 3 stages of recovery post-pandemic. And the third stage is one which he says could be sort of an irrational exuberance, where the opportunity to have social interaction again seizes individuals. And that may be very good for industry in terms of tourism and congregate settings, but it also may be something which, if conditions aren't appropriate, may lead to refueling outbreaks and epidemics. And so I think one should be thinking about that medium term and understanding some of the behavioral responses, which may either be particularly good for industry or may create new threats.
Certainly. And I absolutely love that you brought up human behavior. So you don't know this, Tim, but way back in my background's in neuroscience. And so I obsess when I approach any public health problem over human behavior and how we deal with actual human beings and not just write policy for an idealized world. And so I really like your point about that irrational exuberance. I wrote it down. And you mentioned the United States, where I happen to be. And, we make up 4% of the world's population. And I can tell you that, our experiences are very different than many of the other countries that I work in. And we are there. In fact, I see the restaurants near my house in DC are flooded with humans just congregating morning, noon, and night. And the longer the sun is out, people are, just outdoors at all hours and itching to travel. In fact, I know a lot of even older people who haven't been vaccinated yet who are starting to move a lot more than I'm comfortable with. So everything you said resonated really well. So given the differences that we're seeing, not just between countries, but between cities and rural areas and just different communities, how the very broad question is, how do we obtain herd immunity? But then specifically, given how different communities are, how do you see us obtaining herd immunity in different populations?
That's a great question. And I think the first answer, and you may not be surprised by this, given your own background, is that it isn't a one size fits all. And I say that because if you look at the different risk communities, even within the United States, the patterns of transmission are enormously different. You have areas that have massive levels of natural infection. New York State, for example, Florida, Texas. And so the trajectory there to herd immunity with vaccination is actually much less daunting than it is for places where there's been relatively no infection. Those populations remain immune naive in many respects. There's been no infection acquired or very, very low levels of infection acquired immunity. And as a result, the virus, if it happens to find itself in those settings, will take off just like a fire in a dry forest. So I think one has to pay attention to those settings. The second is we have a complex and evolving situation with respect to new variants. And these are changing the transmission dynamics as best as we can tell, making transmission perhaps easier. And may well be creating problems on the effectiveness of some of the vaccines. We're not quite sure about that, but and I think it's going to be extremely important to track those variants with a view to understanding whether what their implications are for achieving herd immunity. If you're losing effectiveness of vaccines in those settings, then the public health measures are going to be absolutely critical. And the time to get to herd immunity is probably going to be longer. And adjusting expectations of the population are going to be particularly important. The last thing I'd say on this gets back to behavior. And I think the biggest risk of the vaccine path to herd immunity is that once people feel they're vaccinated, they feel like they can go back out and congregate and have fun and everything. And it's a very difficult thing to understand that actually, at least for the next 4 to 6 months, that you have to remain with all that public health vigilance, mask wearing and avoiding congregate settings, because we still don't have good evidence on whether vaccines prevent transmission. And you can still get the virus and you could transmit it while you're vaccinated or having been vaccinated. And so knowing that that remains an important risk, we have this tough behavioral challenge, which is to delay the celebration of I'm vaccinated, I'm protected, this will be helpful. It'll avoid me getting severely ill, but until we see rates of transmission go down everywhere, we still have to realize you're a potential agent of transmission, even though you've been vaccinated. That's really tough to manage on a behavioral front. So we need some of your behavioral neuroscience to help us through on that one.
Well, I think that celebratory piece is really important because we have to strike a balance, which part of the hesitancy, right, is we've got to validate people's decisions to get vaccinated. And so we have to celebrate it and be excited. And I know when my dad got his, he got all kinds of emojis over text, and confetti, and he was hesitant. And so I wanted to make sure that my sisters and I really validated for him that this was the right decision. But then to temper it with, but don't change any of your behaviors. It's a difficult thing for people to embrace, especially when they're so desperate to get back out, which actually sort of segues into where I'd like this conversation to go next. And I'm hoping that Minister Bartlett can join us soon. And that's talking about, at the very beginning, when you talked about confidence and recovery, you said there are certain industries that have taken a much harder hit than others, and you brought up tourism specifically. And so as people build their confidence and expectations change, what does recovery look like in tourism-dependent economies? And how do you think that's different from some of the other economies?
Well, I think it's a great question. I take myself as a case in point. For the last 30 years of my career, I've been on the road in planes about 150 to 200 days a year. So almost half of the year. And in the last 12 months, I've not been on a plane. And my story is corroborated or is multiplied by thousands of people who similarly have just been grounded. And I think the issue is in the last year, it's all reasonable with the uncertainty. The question is what pattern, what will happen moving forward? And there are a number of dimensions of it. One is just like this meeting. Although it would have been great to be in Jamaica rather than freezing here in Montreal, the ability to connect and have a meaningful interaction through information technology is pretty powerful. And so I think just the economics of managing interactions through that are very compelling and will be difficult to see people forgetting this and moving back full force to those sorts of meetings where I used to save the world at least twice a week with the meetings that I went to. I'm joking. We'll see that, in fact, you can make contributions sitting from your desk and working on things virtually. I think that's one dimension. I think the other is that the ecologic side of this, the environmental footprint. I think there's a dividend there, and I think people will be perhaps more conscious of that and in thinking about moving forward. So I think how tourism destinations reposition themselves in that setting is going to be one of the one of the great opportunities and challenges, because the previous conditions, I think, and the experience of the pandemic are ones that do not foster a restart as things were, but perhaps a different type of restart. And that might be that you position things in a way which captures a niche, because there's no question that people love to congregate. That's human nature. And as Nicholas Christakis has said, we're going to see this enormous outpouring and trying to catch up. And so I think that's an opportunity. But it may be that the tourism industry can position itself in such a way that it is its environmental, ecologic footprint and its sort of role in building social capital as a critical part of people's existence can be seen as more central. So I think it's going to be tough, but I think it's a great challenge for the industry to have.
Yeah, and well, first, I also wish we were in Jamaica. It's not nearly as cold here in Washington, D.C., but I'd give anything to be in Jamaica right now. Speaking of, I would love for the audience to remember that in a couple minutes, I will actually be posing questions from the audience, so be sure to send those in if you have them. So, as you talk about restarting, I love that you mentioned the environment. It's not something I've heard as a response to thinking about recovery. And as we restart, when I think of status quo not being good enough, not going back to the way things were, things that come to mind for me immediately are education. And but now we're seeing, entire economies, as we're talking about, depend on travel. They depend on tourists. And I love this environmental angle. So then let's bring in your area of expertise in terms of vaccines. And as people get excited, perhaps irrationally exuberant, and but even if we are rational, and even if we take all the precautions, for those who begin to travel, for them to have confidence, with geopolitical differences and all the dynamics, what are your thoughts on what we're hearing a lot of right now, which is this sort of universal health passport? Is that something you think could be a reality? Is it just not feasible in certain places? What are your thoughts on this idea?
Well, it's very topical at the moment, and it's a great question. So the first thing is that we already have different forms of universal health passports. So many countries, if you don't have your vaccine card, your yellow vaccine card that was created in the 1930s by WHO, and you don't show proof of yellow fever vaccination, for example, then you're not granted entry to the country, or you have to get a vaccination and to enter the country. So it's not as if we haven't had some form of passport based on having acquired some form of vaccination or some form of health intervention. Secondly, a lot of schools require children to be fully immunized before they start school. And so we have that experience as well. And then the third thing that we're already seeing is in order to get on a plane, you have to show that you're RT-PCR negative, that you have a negative swab test. And so in many respects, you have to have a passport to suggest that you have no acute infection that to be allowed onto a plane or back into a country. So these are things that are already in practice. And I think what's really important in the context of vaccines is setting up a system where you have a reasonable assurance that the system can't be gamed, which is a big issue, and that it protects people and treats them fairly while understanding the importance of an individual's lack of vaccination with respect to population risk, I think managing those is going to be very important in those systems. So I think they will happen. Private businesses are already instituting them and things. I think what's really important is for the public sector to move as quickly or more quickly to make sure it's done fairly and with good technical standards that avoid the risk that these things can be corrupted and fabricated in a black market, and also protect people's identity appropriately.
Excellent, thank you. And I see that Minister Bartlett has joined us. Parliament is running. Good, well, we're glad to have you. So I'd like to pull you into the conversation that we're having. So we started, and Tim was talking about how, vaccination is, he said, is our greatest exit strategy to this pandemic. And then we talked a bit about, the impact on the economy, but how different it's been, both between, different regions of the world, different countries, different communities, but then different sectors of the economy, and how tourism in particular, has seen significant changes in sort of where we go from there. So I'd like to ask you, very specifically from your experiences and the plans you have ahead, how do you see the role of vaccines in tourism recovery? And what do you think are the economic shifts or plans for the coming year and after that? Nope, you're on mute. I think you're still on mute. Hold on.
Miss somebody, yes.
There you go.
Good. Thank you very much. And I apologize for not being on the panel earlier. I think we did indicate that I have this dual role of being leader of the House of Parliament, and the most important committee of Parliament is the Standing Finance Committee that examines the appropriations budget. Nothing happens without that, as you know. So I had to lead off, and then I asked their permission to come and join you. And thanks for the opportunity for us to join in this discussion. It's a very important discussion because tourism is such a critical economic activity globally, one that has morphed into being the fastest growing in the last 25 years, that employs just a little over 430 million people across the globe and account for in excess of 10% of global GDP. They have developed also in that process a number of highly tourism dependent countries in the world. I think there are about 66 of them, and we here in the Caribbean are in the top 20 of that. And the measurement of it is the level of dependence that they have by way of the GDP. And in our own space in the Caribbean, we have countries that have up to a 95% dependence on tourism where GDP is concerned. In the case of Jamaica, we are number 17 on the list of 20 in the region, and our dependence was up to 34%. So what it means also is jobs. A huge number of jobs are dependent on tourism. In the Caribbean, over 2 million people are employed. And in Jamaica, we have 170,000 direct employment. And indirect and induced, you are into the region of about 300,000. So that represents just about 20% of your workforce. So any disruptive activity, such as a pandemic, will have a deleterious effect on the economy itself. And we have then to look at all the necessary possibilities for intervention to manage the pandemic, but more importantly, to recover from it and then to thrive after it. So the discussion then with regards to vaccine, I think vaccine represents for us the only hope that the world has for a resumption to normalcy. We are well aware, based on the clinical and the conditions guidance that the vaccines doesn't give you 100% immunity. What it does, however, is to create that possibility for you to be less vulnerable. And so what countries all over the world are now seeking to do is to get that vital fluid so that they can reduce the level of vulnerability and to get back to normalcy. We are advised, I think, that the world requires a sort of 70 to 75% of vaccination coverage in order for normalcy. And also at the rate at which the vaccination is being applied, I think it is somewhere in the region of, 1.6 million doses per day in the United States. And I believe, if my numbers are correct, that it's about 225 million doses per day globally. That it would take the world 5.1 years to get 75% coverage for normalcy. Now, the implications of that are dire, particularly because the larger countries with greater resources have literally cornered the market for vaccine. Some numbers that have reached me suggest that 75% of the vaccine is already taken over by 10% of the world. 10 in fact, I shouldn't even say 10%, 10 of the big, large countries. What that means is that there are a number of countries that are going to be left behind. Even a more precise number, which I got from Bloomberg last week, suggested that just about 100 countries have vaccine at this time. And there are about 130 other countries that have not had or even procured or a hope of getting a single dose of vaccine as of that report. The implications of that are dire because it's going to create an inequity in the system. That means countries are going to be moving ahead and countries are going to be left behind. And those that are left behind are going to be discriminated against naturally because rules are going to be made on a domestic basis in terms of how nationals would travel, where they would go, where they wouldn't go. So the discussion then for tourism is how do we create the ambition globally to have a more equitable distribution of vaccine so that trade can go in a reasonable and equitable way, and that tourism, which has done so much for world growth and development, can have a chance to move forward. We've had many discussions on it, and the discussions continue. And I think that the call is for some global standards, some harmonized arrangements, so that, a system of distribution, of a more equitable distribution can be had. Countries in the Caribbean, countries in places like the Philippines, countries in the Pacific Ocean, countries, the Maldives and so on. All these are very susceptible, vulnerable, and least resource countries that are at the risk of truly being left behind and end up with economic disturbances as a result of not being able to have the vaccine.
I appreciate that so much. That context is exceptionally helpful and really gives a lot of color to the things that Tim was saying before you arrived. So I know that Terry has a question for you. So I'm going to throw it over to her and let her ask that question, and then we will wrap up. Terry?
Hi, and again, welcome, Minister. Nicole, fantastic conversation. The question that I had was actually for Tim Evans, listening to the conversation earlier, and it was, how do we balance that very delicate and sensitive conversation between herd immunity and, of course, educating the society about getting their vaccine? How do we balance that with human rights and persons who are adamant that they're not taking the vaccine? Some nurses that we've seen abroad have said that they're not taking the vaccine. So how do we manage that as a nation, as a society going forward, seeking herd immunity?
Yeah, it's a great question, and it depends in various environments where individuals are either being given a choice about being vaccinated or not. I think we're seeing different patterns of that across different areas. But I think there will never be a fully mandatory regime anywhere for vaccination. And in the absence of that, I think education and understanding is the way forward, because this is not simply an issue related to COVID-19 vaccines. This relates to childhood vaccines and all sorts of other vaccines where we're seeing concerns, often mediated by social media, which are inaccurate and not evidence-based, which are fueling a sense of fear. The reality, however, is that fear is real amongst individuals. And in particular in the context of COVID, where vaccines have been approved very quickly, I think some people feel that somehow perhaps safety corners were cut. So another very important public sector role is to make sure you have absolutely fail-safe vaccine surveillance systems to pick up any adverse effects from these vaccines. And I think that can often promote confidence when you start to look at the rates of adverse reactions, and you see that actually they're very low, and that people aren't dying or suffering other ill effects, then that can be very helpful. I'd like just to say, Nicole, in the context of the minister's, honorable minister's comments, just two things that I think are really important. First is there's a massive global opportunity that we think about global vaccine production for 7 billion plus citizens. And the manufacturing industry for vaccines has never thought about that collectively. And I think that is the opportunity that is before us. And so I think if we secure globally capacity for mobilizing all of our relative manufacturing capacity, no matter where it is, to move in the context of emergency to make sure that we manufacture at 7 billion so that the world, every person, every citizen in the world has access to a vaccine, no matter where they live. I think that'll be a huge accomplishment for civilization. So I see that as one very important thing. The second thing is the issue related to small countries and being very dependent on tourism as a major driver of their GDP. I think there is another collective opportunity there as well. And it may be that we've chatted about these things in the World Economic Forum, which is that the tourism industry globally mobilizes to create some form of insurance mechanism, which would mitigate downside risk for these events because they'll come back in the future. And so if you had an insurance which allowed one to soften the blow and stay the course and not go out of business, then and perhaps as part of that, globally pool procurement for infection prevention control equipment and access to therapeutics and vaccines for your employees and your clients. That may be a way of positioning the industry in such a way that it's much more resilient. And so I think that's another thing which might not be within the reach of a single country, but collectively could be something that's interesting and perhaps 21st century type of solution to pursue.
Excellent. Well, thank you.
Can I make a small intervention there, if you will?
Yes, I know very quick.
Yeah.
I know the next panel's waiting.
It's interesting that the solution lies in this more collective approach. But for our own position here in Jamaica, we have been talking about developing a strategy policy around Jamaica Cares, which really is an end-to-end health logistics program with an insurance component. And that is to enable, and we have had Lloyd's of London and CHS and a number of the big players participating in the thinking on that, so that visitors would buy their insurance ahead of coming, and that would allow them to have coverage for testing, for quarantining, for vaccinating, as the case might be, and a whole range of things. So I think we're onto something there, but Jamaica, for the record, is leading the way in that regard. I just thought that I'd make that puddle play.
Excellent. Well, thank
Great
you.
to hear
And
it.
next year, we cannot wait to be with you in Jamaica.
Look forward to
All
that,
right.
of course.
So I want to thank both of you. This was an excellent conversation, and I look forward to the rest of the events over the next couple of days. So thank you for being with us. And Terry, I will hand it back over to you.
Thanks so much, Nicole.
Thank you.
Thank you, Nicole. Thanks.
Thanks.
Thank you so very much. That was Nicole Fisher. Fantastic questions.